Welcome back to the Mississippi Kidney Foundation Kidney Cares podcast. So excited. I have Dr. James Robinson here with me, TJ Mayfield, the host, the executive director of the Mississippi Kidney Foundation, and Dr. James Robinson. And I should have worn my Alcorn shirt today, but I'm going to let him make it. He professor at Jackson State University, and so excited to have him and talk to him about an exciting project that the Mississippi Kidney Foundation, the Health Equity Coalition of Mississippi, and of course the Mississippi Department of Health, and a couple of other partners that we'll talk about a little bit later in conjunction with. So, but Dr. Robinson, let's go back. Let's go all the way back to your childhood, and let's talk about, how you grew up and introduce yourself to the people a little bit.
Well, I'm James Robinson. I'm with Jackson State University. I'm the chair of the Department of Health, Physical Education, and Recreation. I've been there about 2 years now. But I grew up in Mississippi.
Yeah.
So I was born and raised here, really in Grenada County and Carroll County. So in between Grenada and Duck Hill, Mississippi. So grew up right around that area, grew up in the Mississippi Delta from parents that were factory workers that had their own garden, and we lived pretty much out of our garden. And my parents, the traditional roles, but we really did. We were a lot of deer hunting, a lot of duck hunting, things like that. So using the food that we had there, or that was local, that we could have.
Yeah. So talk to me about the garden. I mean, I'm a guy. My granddad had a big garden. I love the squash, the mustard greens, all of it. Talk to me about the garden, and did you get out in the garden a little bit?
Yeah, that's right. My parents always had a garden, and my grandmother lived next door to me my entire life. And so she taught me these skills and told me these stories, which a lot of grandmothers do here in Mississippi. And she talks a lot about the past and a lot about how she grew up and how hard times were back then. So she always instilled in me that you should always do your best to grow your own foods.
Right.
And I always like to say that she was organic before organic was cool, right? Because she didn't use any pesticides or anything like that.
Organic.
That's right. It was all organic. You didn't have to worry about it. But she did, and she taught me a lot about gardening and that skill set. And of course, as all good grandmothers do, she would tell me stories while we were gardening and showing me how to put a road together with a hoe, right? So she didn't use, a tiller or anything like that. She got out there and she had her hoe and she made her rows, and we planted. And of course, we had everything. So we had squash, we had cucumbers, right? And she had a garden throughout the year. So grew pumpkins, grew watermelons, right? So okra, corn, peas. And so I spent a lot of my afternoons during the summer with a 5-gallon bucket in front of me with purple hull peas in front of it, right? So putting together our feed, getting all the peas ready to go. And then she taught me how to can, right?
Yeah.
And to put up food. So anytime we had, we probably grew an acre of tomatoes, just on tomatoes. So we would get out there and we would pick those tomatoes when they were ripe, and she would show me how to can, and she taught me how to have a cold storage, right? For that food, and we would use all of that canned food throughout the year. So we would make all of our soups with it, and of course our green beans that we canned. And they taste so much better, TJ, than anything that you can get in a can in a refrigerator. That's for sure. And she taught me how to cook, fried peach pies and everything that they did, and how to build a menu from scratch.
Right. And we'll come back to the food because, of course, you and I have talked a lot on this upcoming project about the importance of food and healthy eating and exercise and all of that. But you have a mindset for healthcare, wanting healthy people, especially in your home state of Mississippi. You also did some work in neighboring states. Where did that mindset come from, making sure healthcare was a passion of yours?
Well, your health is your most important asset throughout your life. And Mississippi, I was born and raised here. I love Mississippi. This is my home. And I worry about every citizen that we have, especially in terms of healthcare or the lack thereof,
Right.
and then us losing our ability, or maybe that's not really the right word, or our understanding about good health. And I tell my students all the time, and really anybody that'll listen, is we really have a Pac-Man approach here, right? So if you think about Pac-Man, the old video game, right?
Yeah.
So if you look at Pac-Man, right, when its mouth is open, it has that little V, that little greater than sign, right, when its mouth is open. Well, your life from 0 to about age 50, is that Pac-Man. But that V, that's the rest of that Pac-Man and the rest of that circle. That part of your life really depends on how much you've taken care of yourself in all the other parts of your life, right? So if you're eating healthy and not even exercise, but just physical activity in general, right? So getting outside and doing those things. If you have done all those things and you've taken care of yourself and you've done some other things as well, right? That little piece of the pie, you're going to live very well, right? You're going to be able to chase your grandkids around, right? And you're going to have this great life from 50 all the way to 85, 90, maybe even 100, and that is going to be good quality of life. But if you didn't, right, and you've been eating poorly, right, and you've not been exercising, or God forbid something else happens that is out of your control, that part of your life is not going to be good quality, right? You're going to have poor mobility, right, and you're going to have poor health outcomes, and you're not going to be able to chase your grandkids around the yard. And so really that's where I'm coming from, because I want those parts of our citizens' lives to be great, to be meaningful, right? And that's really where I am with that.
Yeah, and you come from small town Mississippi.
That's right. Yeah, very small.
As for so many of us, rural areas, not
Right.
a lot of access to resources, food deserts. And that's one of the reasons why the project that we're working on is so important, because a lot of people don't have that access to fresh foods, to clean water, and so many other things that they need. And that leads to diabetes and high blood pressure and eventually kidney failure, of course.
Right.
So talk about the importance of educating people. You talked about it. You grew up and your grandmother taught you all these things of having fresh food and saving it for later. Talk about some of the people nowadays don't have access to it. What can we do as a Mississippi Kidney Foundation, Jackson State? What can we do better to educate people about some of the issues that they're facing in their community?
Well, at Jackson State, I'm in the College of Education and Human Development, and we're passionate about two things, right? Student success and health equity. Those are the two things that we are passionate about, that we are trying to change the scope of Mississippi, and we want to be the state lead, right, in those two domains. And so that's what we're trying to accomplish, and to take our students out into these rural areas and show them exactly what's going on there, right? So the closing of our rural hospitals, right, is having a tremendous impact on the health of our citizens in those areas. And I'm gonna show the students those stories about those individuals. They have to drive 45 minutes, an hour, if they have transportation to get to the next hospital. And maybe the hospital doesn't have the care that they need at that particular hospital. Maybe they have to come down here to Jackson to get that done. But I'll tell you, some of our rural doctors and our rural nurses and our other healthcare providers that are in those areas are doing a tremendous job in those areas, but they are strained. They have limited resources, and they are strained to just so many people need their help, and they get overwhelmed and they get burned out, right? So we have a lot of variables that are going on, but we want to get our students there so they can see these issues up front, so that they know that a majority of the food that some of those citizens are eating in these cities are coming from gas stations. They may eat at gas stations 3, 4, 5 times every single day. And do you think that that's the healthiest food on the planet? Now, does it taste good? Oh, man. Right? There's nothing better than gas station chicken, right? I mean, this is Mississippi, right? This is Mississippi. But you can't eat that every single day. So as part of this project that you and I are working on, that's why it's important to go there and say, you have to limit this, right? And to show them or take them to a grocery store and say, this is what you can do, right? And you can also garden.
Yeah.
You don't have to have a lot of space to have a great garden, right? That's one of the things that I learned. You can do a boxed garden that is 12 by 12 in your backyard and grow a lot of your own foods now. And it's not hard.
Yeah.
And also, we're going to teach them also, and we'll talk about the project more in depth,
Yeah,
I'm
yeah,
sure
yeah,
in just a minute,
yeah.
but to actually teach them how to cook these foods so it tastes good. You know, every time I talk to somebody, it's like, oh, we're going to have bland chicken, we're going to have these bland vegetables, right? And it's not going to taste very good, you know, and it's health food, right? When in fact, it is supposed to, this is the food that you're supposed to eat every day, right? For 3 meals a day and your snacks and things like that, and healthy snacks. But how to prepare that food so that it tastes good. You know, going back to my grandmother, that's what she taught me.
Yeah.
These are the things that you need to eat, but here's the spice.
Right.
Here's what you cook it. Here's what you cook it with, right?
Yeah.
And this is how you make these things taste good, right? You can, would she ever throw cheese on her vegetables? No. Right. No, those vegetables were spiced great, and they tasted good, right?
Right. Here with Dr. James Robinson of Jackson State University here on the Mississippi Kidney Cares podcast. Well, Doc, this is why we're here. Let's talk about it. The project that we're so excited to start. We'll be starting soon in Clarksdale and Coahoma County School District. By the time some people hear this, it may be after we complete our first of 9 school districts with this project. Like I said, partnering with Jackson State University, Mississippi Department of Health, the Health Equity Coalition of Mississippi. First of all, just tell people how we got the idea and got to the point of we can change lives with this project.
We certainly can. And what I love about our relationship, TJ, is you and I just met on a whim.
Yeah.
Right? We just met on a whim. We were down at Sal and Mookie's here in Jackson, right over in the Hanover district. Right? And we were having dinner.
That was my first time at Sal and Mookie's.
That's right. The first time at Sal and Mookie's, right? And I don't even remember why we were there. Right? I just know it was our some of our faculty and some of our families there, and I think Sweet Pea was there, and I remember us meeting right there. And we were talking about, what do you want to do at the Mississippi Kidney Foundation? You know, how do you want to change lives? And of course, we immediately hit off because we have a shared common interest in public health in the state of Mississippi.
And also education, because of course I'm a former educator. So the ability to use my mindset of being a former educator, not just show people, but teach them as well.
And we came up, and you and I just talked there, and of course, and they had that grant at the Mississippi State Department of Health Equity, which we want to give a huge shout out to them and for their vision about the state of Mississippi going forward. And they have been tremendous partners so far. But to be able to give this grant and to really see what we're trying to accomplish all over the state. And they were so kind to us, right? And they were so adamant that this is exactly what they want to do in the state. These are the things that they want to partner with, and they want to see this change. And so we're really excited to partner with the state, to partner with the Health Equity Coalition of Mississippi, Jackson State, Mississippi Kidney Foundation, and all the other partners that you've brought in.
Wayne Sanderson, they're going to donate chicken. And of course, we'll talk about the schedule a little bit later, but you know, having fresh chicken donated to the project, I think that's a critical part of what we're doing.
It is. Sanderson Farms, who is now another institution, we don't have to really get into that, but Sanderson Farms for a long time has been working in the sphere in Mississippi and doing great jobs, especially through their foundation. So we're really proud to partner with them, and they understand the need for this food in those communities, and we really appreciate them. 200
pounds of chicken donated. So excited about that part, but let's get into the day of event. So, of course, we're going to Clarksdale soon. You know, like I said, by the time people hear this, we probably will be in Clarksdale by the time some of the people listen to it, or maybe even afterwards. But the day of the event, you know, we're going to talk to the elementary students. We're going to go to dialysis clinics. We're going to talk to transplant patients. And, of course, the Friday night lights and bites with
That's right.
the name you came up with. So let's talk about what we plan to do starting with Clarksdale, Mississippi.
That's right. We're excited to be in Clarksdale. This January the 31st.
That's correct.
Is that right?
That's correct.
In Coahoma County, and not just Clarksdale in general, but all of Coahoma County,
Correct.
right? Because once you get out of Clarksdale, that's really where we want to be. Coahoma County Community College, the high school, the junior high school, we've already met. They've been so open and so welcoming to us, and they've donated their time. And of course, we're bringing all of JSU, right? Not only all of our partners, we're bringing all of JSU.
Right.
We're bringing our tents, we're bringing our tables,
Yeah.
we're bringing our grills. And you're right. We're going to be in a fourth grade classrooms. We're going to be talking about healthy foods. We're going to talk about nutrition, physical activity. We're going to talk about how do you read nutrition labels and why is that important, and the salt content of food, the sugar content of food, especially in terms of the soft drinks that kids drink.
We talk about the Gatorade.
Gatorade,
the favorite
Powerade.
athlete is always on the Gatorade commercial.
Right,
but
that's right.
Not realizing how much sugar is in a Gatorade.
Yeah, we're going to talk about those things. We're going to give them a lot of visual aids,
Right.
right? So our professors from Jackson State are going to come, and they're going to talk about these things, and they're going to do a great job. And then they're going to ask some really good questions, because we want to know the stories about these communities, right? I grew up there. I get it, right? But we want to hear those student stories today. How has those communities changed since I've been there? What are the struggles that they're going through? How did COVID impact them? Right? What's going on with their health care locally, and how we can be that change, right? Because at Jackson State, that's what we want to do. We just don't want to go into a community, do a thing because the grant said so that we had to, right? And then leave. Right. We want to be there. We want to be impactful, and we want to change their lives, right? Those are the things that's important to us at Jackson State. And we want to make sure that we do those things, and we have a lasting relationship with these communities. And we want them to tell us their stories. And we want to base our research projects on the things that they say. Right. We don't want to go into their community and say, this is what we want to research, right, when we haven't heard their stories. So we want to hear from them. What problems are they trying to solve? How can we be better partners of their communities? Those are the things that we're trying to do every day. Those are the stories that we want to hear. That's how we're trying to be impactful. And we're going to go and we're going to talk to these fourth graders, right? Fourth graders are always fun, right? Yeah. So who knows what we're going to get, but we're going to talk to them. But we're going to go out and we're going to see our kidney patients, right? And listen to their stories, videotape their stories. So we'll have a better understanding of where they are and how the healthcare has really impacted them as well. So it's that storytelling, and we're going to collect this data. Of course, we call it data, but it's really these local stories that we want to hear. And we're really excited about that. And then, of course, Friday night lights and bites. But on this one, it's going to be Tuesday night lights and bites. So we're setting up our JSU tents. We're setting up our Mississippi Kidney tents, all of our tables, all of our grills, just like we talked about. And everything that we talked about that morning in that fourth grade classroom, we're going to show them, right? Mm-hmm. So this is a teach me, show me moment. And we're going to have that chicken on the grill. We're going to have those vegetables, and we're going to teach them how to do it, right? So, and I think my grandmother would appreciate this. And of course, she lived, until she was 94, so she lived a long time. She taught me a lot. But I think she would appreciate of me telling her stories and continuing that legacy of how you cook and how you spice these things, right? And we're going to give that food out, right? And they're going to be able to QR code these recipes, these healthy recipes, and they're going to have videos of all this, and they're going to be able to see it. And we're going to
digital billboards to promote it in their community.
That's right. That's one of the things that the Mississippi Department of Health was very adamant about, of us getting our word out, us getting our data about our kidney disease patients, our kidney dialysis patients, making sure that we understand where they are in our state, and promote, and making sure that these communities are aware that we're coming.
Right. So we talk about the healthy food. We talk about the resources that the people will have. The one question that we've already heard from the school district and people, why us? Why do you want to come to us? And of course, the answer we've already had, well, why not you? why not the communities that feel forgotten about, that feel left behind, that sometimes don't get those resources that the people in Jackson or the metro area get? How important is that to you? Like I said, you come from small town Mississippi. Vicksburg isn't that big, but it's a little bit bigger. But how important is it to you to go to a Charleston, Mississippi, or Clarksville, Mississippi, to help people that really need our help?
It's critical. And in my past, I've worked in small rural institutions, and I've worked at large urban institutions. And if when you think about Mississippi in general, and we break it down by the same way the Mississippi State Department of Health does, right? So north, central, southern. And if you think about our small towns in Mississippi and all the things that they're going through and the data that we know right now, it is critical that we're out there and understanding what's going on in those communities. These communities are strained resources.
Correct.
You know, and everybody knows what the statistics are in Mississippi. And I was having this conversation just a minute ago, is there are pockets of people in Mississippi that are doing tremendous work with zero resources.
Correct.
Nothing. They're just bringing it out of thin air. And they're still getting the job done. But the state as a whole, and if you think about statistics in cardiovascular disease, diabetes, and all of these things, right? The needle is not moving enough.
Right.
Right? And the time has come. You know, it's 2020, what is it, 2023?
Yeah,
2023, right? But the time has come. And I know, and all of my mentors and all of the legacies and everything that we've done in Mississippi up to this point, it still hasn't been enough. Right? And it's going to take individuals like us, grassroots individuals, foundations, Jackson State universities, but in partnership with all of our institutions across the state, right? Especially UMMC, DOM, everybody down on the coast. We have all got to get together to drive this change. We can no longer accept to sit back and let others dictate the health of our citizens, especially when only a few are getting the resources that they need. That's why it is critically important for us to be in these communities, right? And so that we can tell their stories on a large scale of exactly what's going on, what disparities still exist there. Right, and drive change to increase health equity across the state of Mississippi.
Right. Well, Dr. James Robinson, we really appreciate you. Before we wrap up, anything else that you want to say or promote coming up?
Absolutely. I always want to thank our partners. Yep. So the Mississippi State Department of Health, Health Equity Coalition, Mississippi Kennedy Foundation, last but not least, I love Jackson State University, right? And I just want to put the word out there that it's going to take all of us. Right. So all of our foundations, all of our partners, and anybody that wants to be a part, we welcome it, right? And we want to partner with you. We want to drive that change. And I just want to thank these school districts and these communities for being so welcoming to all of us. And we appreciate them. And I appreciate the work that you're doing, TJ, right? This is a labor of love for you, and it shows in everything that you do every single day, and I appreciate you. And thank you for having me on and for bringing awareness to what we're trying to do at JSU.
Absolutely. Well, if you want to meet myself and Dr. James Robinson, we will be at the Mississippi State Capitol on March 9th. We'll have a Mississippi Kidney Day. Come out and support us, and we'll also have our Advocacy Day at the Mississippi State Capitol, where meet with legislators, state representatives, everybody who has a say-so in healthcare in the state of Mississippi. Come out and support. That's March 9th on the Capitol steps. So we'll have the media out there. Come out and support. Come meet us. If you have any questions about the Mississippi Kidney Foundation, Jackson State University, feel free to come out and support. But for Dr. James Robinson, we thank you once again for all of your work with Jackson State University, with the Health Equity Coalition, everything that you're doing. Thank our sponsors, especially Aligned Health Solution, for sponsoring this podcast. We really appreciate you. And most importantly, thank you, the listener, the viewer, everybody who makes this show possible each and every week. Remember to like, subscribe, everything. bring people in. Let them listen to the podcast as well. Quite sure they'll get something from it as well. The Mississippi Kidney Cares podcast. We thank you. We love you. Peace.